Certainly is. That was Trevor Ault reporting. To talk about how deadly pneumonia can be and is, let's turn to Dr. Janette Nesheiwat, a board-certified family and emergency room physician. Dr. Nesheiwat, thanks for joining me.
My pleasure.
So I mentioned how shocking this case is because Ed Ashoff was so young, just 34 years old, seemingly in good shape. Many think that at that age your body can fight off pneumonia, but apparently not.
Absolutely. This is actually rare. It's rare to die from pneumonia. It's a very common disease, but it's rare to die from it, especially when you're a young, healthy person. Now, pneumonia is an infection in the lung. Inflammation occurs in the lung, and it's usually viral or bacterial, and sometimes it can be fungal. And for him, it started off as a virus. He was suffering from an upper respiratory tract infection, usually caused by a virus. He was having coughing and fever for about 2 weeks, and then apparently it may have turned into, or he may have developed a secondary bacterial infection, which is why he was put on antibiotics. But sadly, those antibiotics did not work, and his condition worsened, and he succumbed to it, unfortunately. And that's why it's so important, to see your doctor regularly. Make sure you're up to date with your vaccines. Make sure you're up to date with, your routine physicals, because this is very preventable by just taking simple measures of hand washing, avoiding people who are sick,
right,
getting your flu shot, that sort of thing.
So could he have been able to tell that the antibiotics that he was on weren't working? I mean, how would he have known to maybe go back to his doctor to get that second look?
Good question. If you're not seeing improvement after 2 or 3 days of antibiotics and you're getting worse and you're having cough and fever and chest pain and weakness, that's when you need to go back to your doctor right away, or go to the emergency room if you feel weak and you can't breathe, because it can be life-threatening. Even though, again, it's rare to kill, it can be life-threatening, especially if you have any other underlying medical conditions like asthma or COPD, or maybe in his case, we don't know what his underlying medical conditions were. Was he a smoker? Did he vape? Did he have maybe something else undiagnosed that we're not aware of? So that's why it's important, follow up. And all his doctors, I'm sure, said to him, look, if you're worse, if you're not better, come back. But he was found to have what's called multifocal pneumonia. That means the infection in his lung spread to other parts of his lung. And sometimes oral antibiotics aren't enough, and sometimes you need IV antibiotics in addition to oxygen and fluids and close monitoring.
So it sounds like he needed to be hospitalized.
Potentially, but he may have thought, oh, it'll get better, or I'll get better, I'll give it more time. But you got to listen to your body. And if you're not getting better, if you can't breathe, if you're having trouble, sleeping and chest pain and coughing up mucus and blood, that's when you got to see your doctor right away. Let them evaluate you, because it could potentially be life-saving.
And we're also hearing the flu is more, of a concern this year than in years past. A lot of people getting it and getting it in a serious way, right?
Absolutely. And you can start off with a flu. You can have influenza A or influenza B, which we're seeing a lot of right now. You can have influenza pneumonia, and you can still develop secondary bacterial infections because your immune system is weakened. Your body is fighting hard to attack the virus. So that can definitely make you more prone to secondary bacterial infections like sinus infections or ear infections or bacterial pneumonia. We don't know if this was maybe influenza to begin with, and maybe he just didn't get on the proper medications in time, or he had a strain of a virus or a strain of pneumonia, whether it's mycoplasma pneumonia or strep pneumonia, that just one type of antibiotic wasn't enough. Maybe he needed to be on 2 antibiotics. We don't know the exact type of infection he had. But again, this is sad, this is heartbreaking, but it is preventable and it is rare. But again, so important to practice proper hygiene, hands washed and clean. Don't rub your eyes and your nose. And again, make sure you're up to date with your flu shot. It's still not too late to get your flu shot this season.
And you say it's rare to die from pneumonia. Is it more rare in younger people than older people? Where does age factor in?
So you're usually those who are very young or the senior citizens under age 5, under age 2, and also senior citizens are at high risk for complications. Also, if you have any history of a weakened immune system, if you're undergoing chemotherapy, if you're HIV positive, if you have cystic fibrosis or asthma, or if you're pregnant, then you're at a higher risk of complications of pneumonia. That's why, again, close follow-up, routine physicals are important, because we have vaccinations if you're in the proper age group for pneumonia. There are pneumococcal vaccinations that can help protect you. And so that's why it's so important to see your doctor routinely and regularly.
Right. Certainly our thoughts are with Ed Eshaw's family, including his fiance, who he was set to marry in the spring. Dr. Janette Nesheiwat, thank you for joining me.
My pleasure. Thank you.
All right. Finally,